Dr. Gaurav Kharya, and I work as a Director Center for Bone Marrow Transplant and Cellular Therapy at Indraprastha Apollo Hospital, New Delhi. Gene therapy, as you might have heard, is coming up as a revolutionary approach to treat various human diseases. For example, thalassemia and sickle cell disease. Now, you might have heard of thalassemia and sickle cell disease. These two diseases are inherited diseases, which are genetic diseases, and these two form the largest burden of red cell diseases across the globe. If we talk about the burden of the disease in our country, so almost every year 10,000 kids are born with thalassemia and another 30,000 kids are born with sickle cell disease in our country. Put together, every year 40,000 kids are added to the existing burden of thalassemia and sickle cell disease in our country. It's a huge unmet need to help these patients with curative options. As of now, the only possible curative option to treat these patients is by offering a bone marrow transplant. But bone marrow transplant comes with its own set of challenges and it can't be offered to every patient in need. That's where gene therapy comes in picture. Gene therapy is a way of genetically modifying or correcting the defective part of the genes or the chromosomes where this defect lies. So, for thalassemia and sickle cell disease, both of them are caused because of various mutations in a particular region of the chromosomes, which is called as HBB cluster. Now, if we can by the means of gene therapy or genome editing, we can correct this particular part of chromosomes and then give these cells back to the patients, they can be cured of the disease. Now, how is it done? There are two approaches of doing this. One is using a viral vector based gene therapy approach, where using a viral vector we edit this defective part of HBB cluster. Another approach is using a CRISPR-Cas9, which you can say is a genetic knife. So, using this CRISPR-Cas9 we edit this defective part of HBB cluster and then subsequently remove this defect. So, if a patient of thalassemia and sickle cell disease needs a gene therapy, we have to take out the stem cells, then we have to genetically correct them, and then subsequently these cells are given back to the patient so that the patient can be made free of the disease. So, you can say it's a form of autologous genome edited or gene corrected bone marrow transplant.